So this is the second webinar organized for the Inclusive Community of Practices after the launch of the Inclusive Education Handbook held last September 2016. One of the key recommendations that came out during the discussion of this session last September was the possibility to have additional webinar in order to share experience such as best practices and lessons learned from specific inclusive education programs. So we have found some volunteers from different country offices willing to present their experience in inclusive education. Before continuing our webinar, I would like to ask anyone who is not speaking to mute the microphone to avoid hearing the background noise. Thank you very much. And I would like to invite you to present yourself, writing your name and your position in the chat box. The presentation will be about 25-30 minutes, and then we will have 30 minutes of question and answer session. During the presentation, you can use the chat box to write your question and comment that will be read at the end of the presentation. Before hearing the experience of Bosnia Herzegovina, I would like to remind you our definition of inclusive education for Save the Children. Inclusive education is education that enables all children to learn together with the support for their individual needs. There is no standard model for ensuring that education is inclusive and responsive. Inclusive education ensures the presence, the participation, and the achievement of all learners in place of learning. So if you remember, and we had the chance to go through our Save the Children Inclusive Education Handbook, you can remind that the inclusive education in one dimension of the right-based quality education, which emphasizes equity in access and participation, and responds positively to the individual learning needs and competence of all children. As we are a child rights organization, inclusive education is also use a child-centered approach and place the responsibility of adapting the education system rather than the individual child needs and competencies. So together with the wider community and with also other sectors, Save the Children work actively to ensure that every child, irrespective of gender, language, ability, religion, nationality, or other characteristics, is supported to meaningfully participate and learn alongside his peers and develop his or her full potential. I hope that everybody can see the presentation. If you cannot see the presentation, you can go through the attachment and to download it. So anyone can see the presentation. Sorry for that. Yes, Hania, if you can help us with these technical issues. Yeah. So I don't know if you prefer that I went back to the previous slide. I think it was clear, the inclusive education definition. So the Inclusive Education Handbook has been developed specifically for Save the Children program staff, for the implementing partners and practitioners supporting the education program in any context, either development, emergency, or protracted crisis. If you remember, the structure of our Inclusive Education Handbook is a simple step-by-step approach. So it has been structured around the program cycle steps. One chapter for each program steps, and each chapter follows the implementation focus structure. So the handbook has been structured to guide the implementers to build inclusion into each step of the program cycle. Whether if you are designing a new project or you already are at the stage of full implementation, the guidance that you can find in each of the chapters will help you to consider the different factors that are influencing or excluding the children in the school where we are our project intervention. So following the structure of the Inclusive Education Handbook, in each chapter you can find a description of what happened when the step is not inclusive, the concrete guidance for how to make this step more inclusive, the case studies, and the quick reference chart. So we thought that it was good to follow the same structure of the Inclusive Education Handbook, and each webinar will have a specific theme based on the 5 steps of the program cycle, such as the situation analysis, the program design, the monitor and evaluation design, the implementation and monitoring, and the evaluation and lesson learned. So today we will have the first session that will present case studies and experiences related to the situation analysis step within the Inclusive Education Program in Bosnia Herzegovina. Now I will leave the floor to Fatima Smajlovic, the Program Implementation Manager in Bosnia Herzegovina, that will present their approach and their experience in the situation analysis steps.
Hello, everyone. Greetings from Sarajevo, Bosnia and Herzegovina, from Save the Children in North West Balkans, covering Bosnia and Herzegovina, Serbia, and Montenegro. Thank you very much for this opportunity. It's a privilege to share the experiences from one of the countries where we work, from Bosnia and Herzegovina, being also one of the most peculiar areas to work as well. So I will, Anna, would you just place the first slide for BIH part? Okay. I guess I can also manage it from here. Everyone hearing me well? Okay, thank you. So I just want to start with, let's say, presenting the context before I move to situation analysis as one of the, let's say, immediate and the first steps in intervention. We in Bosnia and Herzegovina, we operate in, let's say, post-conflict, middle-income and transitional environment. In a way to say, because given the past and given where we are now, it is very politically and socially interesting area, I would say, to work, where actually there are great level of issues in every sector, especially that is somehow mirrored in the education sector, where we really witness on everyday basis very widespread and very integrated inequality and exclusion, especially of the deprived groups. And one of the groups that are mostly excluded are those belonging to, let's say, minorities, or children with disability, or people with persons with disability issues, or exposed to extreme poverty. Given the situation in our country, let's say we have very complex and fragmented education system in a way that it reflects also the way how country is structured, because we are composed not as a one, let's say, entity, but we do have at the national level 2 entities, Federation of BIH and then Republika Srpska. And then we have 1 district that is under international protectorate. Also that how to say, makes situation even harder, because we cannot have 1 Ministry of Education or 1 Ministry of Health or Social Welfare, but we have, let's say, 14 different layers, among which 12 with authorities and 2 that have coordination role. So if we want to do anything at the national scale, it is really an important, let's say, caution to be taken into account where we work, and we we need to work parallelly sometimes at the national, but also at those, let's say, micro levels, be it with the cantons in federation, because federation is composed of 10 cantons, or if we want to work with Republika Srpska entity, then we would work with one ministry, whereas in federation we would have 10 ministries of education within federation. Inclusiveness is, how to say, in Bosnia and Herzegovina is introduced, let's say, since 2001, but it's introduced such as a proclamation, and it never worked, and it was never supported properly and introduced properly in the system. So we have many issues, starting from data, from support to the teachers, also like approaches to inclusiveness that is actually very much based, or was based, at the medical, how to say, way, not the biopsychosocial, the new trends. So everything is, how to say, very difficult, and everything is challenging given the environment and given the status that children with disabilities are facing. Inclusiveness for our organization and most of our partners, be it government or non-government, is one of the priorities, first priorities, and also that is something that we always say it's a right. So this is like short in context analysis, or where we operate. From our experience so far, and we intensified our efforts, although we worked since 2008 intensively on inclusive matters, but since 2014 we really have approach in which we work parallelly and very deeply at the several levels. One is policy level, another one is practice, and another one is culture. But basically, with this one, with each one of these, we start with a situation analysis. And we usually, in our approach, have model areas where we would come, and then we would have a deep down analysis, and then the participatory consultative process of designing proper intervention that would be usually very detailed, and also like multi-year intervention that would usually have several phases. So far we have 3 areas where we work in federation, in 3 cantons, one that we completed and now have phase 2 with the MAC project, and 2 others that we start 2016, which is like Sarajevo and Tuzla Canton, 2 very big areas. One of these is also like capital of Bosnia and Herzegovina. And within these areas, we start with a very thorough and deep analysis that later on turn into policy strategy document with very detailed implementation plan that I will present in the end, that has at minimum 7 years of, let's say, duration. Themes that we covered with this analysis or explored are all what are available and usually, how to say, taken into account, starting from stats, qualitative data, knowledge, awareness, attitudes, all this like legislation existing and funding resources, like everything that is there. Methodology that we usually, how to say, undertake is a combination of qualitative and quantitative methods, very participatory, and that later on turn into logic approaches. What we can say from our approach is that basically in these areas we involved through, let's say, the process starts when it starts, and once it's finished and finalized into the document is practically last at minimum 7 months. And one of the let's say interesting point is that within this period we practically encompass every possible key actors, shareholders or stakeholders from different levels, so that everyone is practically encompassed, included, and consulted, and let's say we received proper opinion, suggestions, and everything that is needed for such analysis. Usually, what we have is a structure that is run by external party, consultancy agency, or someone that is very experienced in inclusiveness, in inclusive approach, especially in this biopsychosocial model. That actually design with our implementing partners that are government and non-government institutions that design methodological approach and everything. And everything starts with practically desk research, and in desk research we encompass every possible legislation, policy, and those kind of treaty strategies, policy documents, laws, bylaws, rule books, everything that practically needs to be taken into account. And after that, we have this range of, how to say, phases in which we approach after, of course, mapping. Let's say we have those interviews, be it individually or groups. Let's say organized. We organize also technical working meetings in which all major key actors and stakeholders are present and consulted. And within education sector and inclusiveness, we don't anticipate just those actors that are related only to education, but later on in the next slide I will present the, let's say, major informants. We have other related sectors such as health, social welfare, finance sector, also like lower level such as municipal level, and also these that are related to the canton. Also within that, we have those public institutions, centers for social work, those that are having some status such as a commissions for assessments, everyone that is related to let's say the service and one of these areas. Also, we involved all major civil society organizations, organizations that are active and exist in the area, and also disabled people organizations that are also very, very narrowed, working with the persons and children with disability, children and youth with disabilities, parent association, and community members. What we also have as one of the approaches is that this very consultative process designed and defined with many phases that have several rounds of consultations. So once we have the, let's say, focus group, then after that will be another round of consultation, not with the same stakeholder, but that stakeholder that, for example, if it is individually interviewed or it's a part of focus group, later on would again be involved either through technical meeting or through the consultation process that would be organized once we have, let's say, first of the what was collected as a data, then analyzed, and then let's say transferred into a draft document that would later on be presented. We have first round of internal consultations when we have the first draft exchange between those that have participated and those that are partners in let's say in the area. And then we would organize per each of the major area. We would organize roundtables with the one-day agenda, where actually everything will be presented, and then a new, let's say, wave of stakeholders, practitioners, those that were not encompassed at the previous stages would be invited to hear and then to add their inputs. And after that, we would leave the document as well to everyone for, let's say, minimum 2-3 weeks, so that they can actually also return with the written comments. After that, we would organize the final draft, again, exchange with the major stakeholders. And one of the stages is the public presentation that of the, let's say, the strategy, the plan, and everything, where, let's say, minimum 100, 130 to 150 stakeholders will be present and would again be able to be part of this process. What I already mentioned in previous slide, these are, let's say, range of different stakeholders, actors, shareholders who were consulted or involved in the stages. What I didn't mention, that one of the particularity with this situation analysis that within each of these three areas, we introduce one of the element is the analysis of the budget of the, let's say, if there is an area of 10 municipalities, we would identify at minimum 2 municipalities to which actually a separate parallel process of analysis, in-depth analysis would go together with the municipal representatives, their departments of the finance, and then it would be somehow sample how usually the municipal or local level functions, and then how the team of children, youth, persons with disabilities is covered, what are the gaps, and how this can be like, it would also like come out with the range of recommendations, how this can be turned into positive so that they are encompassed with the budget allocations. So this is also one of the additional layers. Here there are just samples of the questions that at different stages would be posed. It's just also like reflecting more or less what was also like presented in the handbook, but usually the questions would, how to say, the questions would try to give the evidences or the statuses, how children with disabilities, youth with disabilities are, what is their status, how they are treated, are they recognized by the system, are they excluded, what are the, how to say, policy, legislative and other mechanisms that actually recognize and provide opportunities for children, youth, and their parents to have rights and to also like use them, gaps, and also like all these, how to say, questions that would give us the real picture, what do we find in certain area, and then that this actually gives us as many as possible recommendations, how we can, what we analyzed and find as a let's say outcome, how this can be then transferred into a proper intervention or plan, how to tackle all these issues. So these are just like something that is like taken as a sample. We can later on discuss and share some of these questionnaires or structures. And after we finish this then we would start with intervention. But the major, let's say, major foundation will be like strategy at the area of this model area, and that strategy would have very detailed implementation plan, which would then very defined who is going to be responsible, duration, resources needed. So practically when we finish the process, then we would be very clear that, for example, for 7 years, for one of these areas that we completed, it's not that they would need for 7 years to solve all the gaps and barriers that were actually encompassed by the strategy and within the plan registered, they would not need millions of, let's say, euros. But, for example, just for one that we completed 2 years ago, they would need 0.54% of their budget invested in education to solve the problems, because there are some elements that are already existing, and those that are missing, it's a clear plan how you will achieve it. And then if ministry or ministries, health, education, social welfare, they cannot cover it, but they can seek for, let's say, support, because then they can easily merge their resources with some possible donor, and it's much easier. So we already, after we finish first model area, we immediately, as one of the partner working very long in Bosnia and Herzegovina, we received several letters of interest from them, whether we can support them to create the same path. And one of the things is also characteristics in this area is that usually government, public institutions, they have their way how they create the plans that are given more in a figures and very short, how to say, descriptions, and usually you cannot see where they go in a strategic way with certain area and certain team. So it proves to be with such approach where everyone in the area is introduced and knows about the process and feel very well that was consulted and given that they provide their input. Practically later on they very much follow what is happening with the plan, and they are all interested. So something what comes out as a, let's say, intervention or project then is much better received and how to say, then later on followed. Then if you have finished the situation analysis, then you produce some documents, submit to your partner, and then nothing happens out of that. This long-term process with very thorough and detailed and consultative and participatory analysis showed that you are already from the very start, you are building this ownership, how to say, ownership elements, and you basically help everyone in this area to first recognize the importance of inclusiveness, and also the problem that many children are not even encompassed by education, any type of education. They are sitting at the home setting, and their parents feel lost because municipality or canton or any level of authority is practically forgetting on them because they have some other priorities. So this practically creates a critical mass and let's say, more critical approach to the team, and everyone becomes in a way sensibilized on the team. And also, like with this approach, we practically emphasize the importance to involve every child, and that barriers are actually removed so that every child can achieve the full potential. Through that process, we can say that there were many challenges. In terms when we started. For example, it was very new process. Usually you would just consult a few main stakeholders or a few representatives from the, let's say, one of these ministries, and you would have a few focus groups. But this was very, for us, hard to start in such a parallel and thorough way, involving everyone practically at certain point. So at the beginning, what we faced as a problem was that they wanted just like formally to finish this, and then they were like thinking that this is it and no one would come back. So basically this kind of continued process was something as a surprise. And also what we discovered with also like our consultants and the processes later on, that even people that are, let's say, invoice for the team, they are so so not sensibilized that even they insult children or parents with a disability, or really with very low level of understanding of the thematic, and also like their role, practically what they supposed to support or give. They would usually just see the financial side of it. So what parent could receive as some small portion of allowance, and that would be it, what they would think. So basically at the beginning was very difficult, but every new area actually discovered that also within the areas they communicate. So once we finished with one and then we started with the new, the good, let's say, the good approach already was transferred. And we have had less problems than, let's say, with the first one that we started in 2014. So for us, lesson learned was that the approach, although very, how to say, complex and also very wide and many parallel processes and very long in a way, it proved to be better than really like going just the desk research and then a few of these events. So this, let's say, in-depth analysis proved to be beneficial for the later stages, because once we finished everything and we presented the strategy, we just needed 2-3 months to prepare basically policy level, and after 3.5 months the strategy was started to be adopted at a certain levels in first area. So basically after we presented the strategy with all this plan and all this consultative process, 5 months altogether after that the strategy was adopted, and later on we were able to start with a new project in that first area that actually has a lot to do with the strategy, because, let's say, centers for inclusive practices with MAC project were part of this strategy. So everything for our stakeholders and representatives and the parents and everyone else was clear, because that was part of the strategy that is accessible. They can see it, and they can see now how the strategy can be implemented. So recommendations from our end is situation analysis, or the start of all this process. Although time, resource, energy-wise, very conceptual, it's important, and it's a first step before opening the chapter of, let's say, long multi-year and how to say, smart interventions that would lead eventually in a certain period of time into a new era of dealing with inclusiveness. And a recommendation is also that all levels need to be very sensibilized through that process, and that there is a certain kind of credibility that you need really to maintain all this time, because after that, when you start new projects, you are doing it in a partnership matters, because you are not just coming as an, let's say, an actor who wants to do something, but you are coming with a proposal for a partnership in which you have a clear plan what needs to be done, that you have a list of needs, and then you practically say, okay, in this partnership we can do this. We would expect you as a counterpart to cover this and this, and then we would agree. So a big success for MAC project, where we actually have had 100% sustainability secured from the very start, is thanks to this process of strategy, analysis, and everything that was invested in a 1.5 year period of time. So basically, yes, it is very, very long and consuming, but it's really necessary in order to get better interventions, more strategic, system-wise, and let's say lasting. So I would leave the floor now for questions I hope everything was clear.
Thank you, Fatima. Thank you very much for your presentation. I cannot see any question in the chat box. If anyone wants to speak directly, or just a few minutes to write the question in the chat box. I don't know if other colleagues from different countries would like to ask some question about situation analysis, and just to have a better understanding if the situation analysis, any baseline, need assessment is not inclusive, we cannot design programs that with an understanding of the education barriers that different children face in having access, participation, and learning. So if you have any question, please feel free to unmute your microphone, and we can have just a discussion all together. By the end of the presentation, we will have some questions for you, but I would prefer to open the discussion now, if anyone is interested on that. Okay, we have one question from Dea, Kosovo. She's asking if when we conduct the situation analysis, if Bosnia Herzegovina use in-house or you contract someone else.
I'm sorry if I was not clear. I said from the beginning, we are the back, let's say, we are on the back, but we always have a third party that is a consultant that has already very rich experience, consultancy agency that has very rich experience in a team. So basically we would do it through the third party, and we would be technical and logistical and also like organizational support, meaning that all these stakeholders would let's say the mapping process would be done in accordance with our previous project connections, and then the letter who would introduce our consultancy agency would come from us, and also like from our partners who are usually from the government. So basically the third party would conduct. Do you hear me? Sorry,
yes.
I have some problems here. I have something that is showing up on the chat, so I was thinking that my line was cut, but not. Yeah, so I hope that I responded clearly, but later on, if you want, I can share more in written from our experience.
Great, Fatima. I don't know if other countries and colleagues have any question about the situation analysis in general, if this webinar was useful for you, or you are still some question and concern that you want to raise now, and to have the opportunity to discuss with other colleagues. I can see that someone is writing in the chat box.
Yeah, I hear the question, quantitative data, thank you, Refik. Quantitative data are gathering for all categories of children with disabilities or only for children who has medical report? Basically, yeah, I didn't cover this. All children with disabilities that are registered through any means, be it through education sector, health sector, or social welfare sector, because one of the issue is that, for example, in area where we would conduct situation analysis through the records of each of these sectors, we would be able to identify, let's say, 1,000, 1,500 children, but then we would be like through other layers of municipality or through parent association, then we would discover that this number is 2.5 to 3 times bigger than those that are recorded either through these allowances, through social welfare, or through health records, or through, let's say, if they are registered and involved in education. So all categories of children with disabilities are encompassed, no matter what type or level of disability is present. I mean, all that we could reach. So thank you, colleague Ilaria. I have a question on what we mean by inclusive education. Some members only refer to children with disabilities, others to a wider approach. This difference surely do not help the CEOs. Please clarify what we mean by EA. How will you ensure that all members are aligned? Daniela, would you like to also respond to this? Because I can also from the practical point, but I also guess this is something from the handbook.
Yes, you can go from this practical point. Just to clarify, as I introduced at the beginning, that for Save the Children, as written in our position paper, in our handbook, we want to ensure that all learners can have the opportunity to learn together in the same place. So our target is the children that are already excluded from the education system and they are at risk of exclusion from the education system. And we don't focus, we don't target only children with disability, but also children with they have coming from minority groups, children that we have language barrier, they are difficult learning, and so it depends really, as I said, is it irrespective from any nationality, gender, language, ability, and religion, and other characteristics. So, and our approach is that to push and to support the education system to adapt to the characteristics and the needs of the learners, and not the opposite.
Yeah, if I also may add from this kind of programmatic, practical and country-wise perspective, by inclusiveness, we also, what you said, Daniela, we 100% also live and work like this, because we worked and we introduced Index for Inclusion methodology that is very widely recognized, and through that methodology we started from the, let's say, wider perspective and approach, taking into account that every child that doesn't enjoy it is kind of, you know, abstract and sounds very theoretical, but in a practice, practically every child that doesn't enjoy equal and quality education would be considered as excluded in a way. Also, we have talented children that are also not recognized by the system, who would again suffer from another, let's say, point. So we were, how to say, we had a fight for several years that inclusiveness is not just, again, related just to the children with disabilities, but that is a wider concept, and that we can also approach to other children that are in a way excluded and invisible. And for a colleague there that says that you are struggling to find good companies, we can share the contacts of the agency that have worked on transformation of, let's say, medical to new ways on the issues of inclusion of children with disabilities, from in Montenegro, in Serbia, in Croatia. So basically the company that consultancy agency that we worked is experienced in the region, and they are very savvy in English, and basically they can be very helpful in what you do. So I can later on exchange the information on the company.
So I think that there is the second part of the question from Ilaria. She would like to know how we can ensure that members are aligned. The Inclusive Education Community of Practices, and that was previous Inclusive Education Working Group, developed the Save the Children position paper and the Save the Children Inclusive Education Handbook, just to give resources for program implementer to understand when you implement, when you design your project, which kind of barriers, how to take in consideration the barriers for children. So also, we are working on inclusive education common approach, that it will be ready and maybe approved, we don't know yet, by May 2018. So we are collecting our experience and best practices from different countries, and to create a common approach and from Save the Children that they can serve as a guidance for the country office to implement their project. But I think that already with our position paper, with our handbook and the collaboration and sharing experience with other countries, we can ensure that we are all aligned in our project, in our position.
Yeah, I completely, I don't have anything to add. Thank you, Daniela, also on that part.
Okay, thank you. There is Cleopatra that she still thinks that the definition is still too wide in developing countries that would include most children. Yes, but I think that when we have to think about children, we have to include both boys and girls of all age in the education system, with different disability and ability and talents. Children who's coming from remote or nomadic population. This is the case also from Uganda, with the linguistic, ethnic and cultural minority who are working, or with children that are on the street. So they are affected by the crisis and conflict. For us, it's really important that, especially what happened in the center and in basic education primary school, can be inclusive, can support the education system in adapting the system and to address the needs of all learners. We really think that all learners can learn, so it's not to be inclusive that all children are together in one place, but that all children are learning with different timing, with different also outcome and different results. So it's very important for us that we, as a child rights organization that target the most vulnerable, we are keen to include all these children and this situation in our project. We face challenges for sure, and we are monitoring, we are trying to monitoring and to collect experience in order to have a lesson learned and recommendation for all countries. And at the global level, I think that inclusive education community of practice is one way how to ensure this alignment. Of course, also the capacity building in each region and the TA at local level can help a lot for implementing the Save the Children approach on inclusive education. I'm not sure if anyone else... Yes, thanks, Dea. So it can be challenging, but we must ensure that all children are included and are benefiting from the education system. Okay, I think if there are not any questions, we can move to the survey. I will leave the floor to Anya.
Okay, hi, thanks, Daniela. I was just going to ask everyone a few questions via this poll. So I'm just going to open the question and then read it out. And if you can all select an answer, that would be great. Okay, so how would you like to keep in touch on this theme of situation analysis related to inclusive education programs? Via an inclusive education email list, via the Global Education Community Group on Workplace, or via bi-monthly Skype calls? Okay, I'll just wait a few more seconds so that everyone can vote. Okay, I'm going to move on to the next question now. Okay, how comfortable do you feel starting or continuing to implement a situation analysis on inclusive education programs in your context? Very comfortable, somewhat comfortable, or not comfortable? Okay, I'm just gonna wait a few more seconds. And I really encourage everyone to vote because this feedback is so helpful for helping to inform future webinars and content and the function of the community of practice. Okay, I'm going to move on to the third question. Okay, and from the inclusive education community of practice, which kind of support do you feel you need the most? What would be the most valuable? And as people have been doing, if you don't see an option here that represents your point of view, please add in comments in the conversation box. Okay, and just as a reminder, please select the question using within the poll itself so that we can record all the results. Okay, thank you for participating in the poll. I'll hand you back over to Daniela to just wrap up. Fatima, are you there? Or Daniela?
I'm here.
Yes, I'm here. So thank you very much for Fatima for your amazing presentation and for your contribution in with your experience in Bosnia Herzegovina. And I hope that other colleagues would like to keep in touch with you and the community of practices to know more about other country office experience. And I don't know if you have any other question or concern about these steps. If not, I would like to thank you again, and we will have a further webinar during this month, during the month of July and September. So I hope that we will have the opportunity to stay with us. Thank you very much, and thank you, Hania, for your support.
Thank you, everyone, also from my side.
Thank you. Bye-bye.
Bye.